Hello guys, welcome back to my YouTube channel. My name is Ngarache. If you're new, thank you for coming. I appreciate you guys for always come to watch my video. I can't take it for granted. You're amazing people. Each and every day you come here and to support me. So guess what guys, today I'm so happy to be here. I'm going to review where I am. Yeah, and today video is kinda different from my vlogs, and because you all know that I'm at medical school, so I'm privileged to visit the biggest hospital here in Kenya of mental health. Yeah, today I'm going to interview someone. She's a nurse, and she's going to talk about mental health and everything. So keep tuned, keep watching, and keep subscribing, keep commenting. If you haven't subscribed to this channel, keep subscribing and commenting. So stay tuned, come along with me. I want to show you where I am. Yeah, this is the place I am. This is some of the institutional houses for people who are working here, living. But the big institutional, the wards are over there. Maybe if I get a chance, I'll go show you. Yeah, but meantime, keep tuned. Yeah, and good morning, good afternoon, good evening, wherever you're watching this video from. Feel welcome, feel free, feel at home, and keep tuned. Stay calm, and we have good thing for you today. Yeah, see you. Yeah, so guys, welcome back to my channel once again. So as I told you guys, today I'm privileged to be in a certain place, a very big hospital here in Kenya. Yeah, where people with mental health do came to get treatment. And yeah, so and today I'm so privileged to have one of the nurse here who is working here, and she's going to introduce herself so that you can know her. Yeah, she's here.
Hi guys, how are you? My name is Daisy Kwamboka. Yeah, I'm a mental health nurse, or rather psychiatrist nurse. I work in a mental hospital in Kenya.
Maybe you can tell the name of the hospital, or is not allowed?
No problem.
Okay.
I work at Madhari Hospital.
Yeah, so guys, Madhari Hospital is the biggest, I think it's the biggest mental health hospital here in Kenya, right?
Yes.
Yeah, this is the I don't know if we have others, but for me, I just know one. When I was growing up, I just know Madhari Hospital. And yeah, here today I am, and I'm so privileged to be here. I've been here once, I think twice or thrice, but I've never been get someone all. And that time I was not doing YouTube, and today I'm so happy to meet Daisy Kwamboka, and I know she has something to tell you guys. Maybe you people, you can learn about mental health here. So yeah, so guys, this Daisy, I think, has introduced herself, and yeah, she's a nurse. You're doing mental health, like?
Yes, I did mental health.
Oh, so maybe my first question is, how do you know when those people are being brought here? How do you know that, like, the condition, this person is suffering from this kind of mental health, or yeah, the condition? What do you look in a person to know about the...
There are many conditions under mental health. We have schizophrenia, we have bipolar mood disorders, we have polysubstance use disorders, we have anxiety disorders. There are many. So each disorder has got its own signs and symptoms that a patient presents with. So at outpatient, first, when a patient comes, you first encounter, you are being taken your vital signs like blood pressure, temperature, those ones. And then the patient goes to a doctor. The doctor will take a brief history of the patient, the onset when the patient started having those symptoms, the bizarre behaviors. Yeah, so from there a mental status assessment is done. That's by doing an MSA, the mental status assessment, is where now you can know what a patient is suffering from. Without,
sorry for interruption.
Without the MSA being done, you can't really know what a person is suffering from by the looks.
So must you do MSA, then you know what kind of the problem someone is suffering from.
Yes.
So do we have different types of mental health, maybe depending on what someone is suffering from? Maybe, I don't know, because here in Kenya most of people who are brought here, maybe they're using drugs, like maybe cocaine, bang or something. I think a large percentage of people who are being brought here, most of them are using drugs, right?
Yes.
Is there anything that in a, let's say in a, like someone is suffering from mental health but he have never been using those kind of drugs or something?
Yes, it's possible, but a number of them they are using, or they used in the previous time. But you can get a person suffering from major depressive disorder, but the person has never used any drug. Maybe the condition, the diagnosis the patient has was maybe caused by other causes, maybe stress, genetics. Yeah, it's not majorly you abusing drugs. Yeah.
So the large percentage of people are those who are using drugs. So a few are being maybe born with them.
Yes.
Oh, okay. So how do you, like, you say we have different type of mental health, right?
Yes.
So how do you guys like treat them? Like, let me how, I don't know how I can phrase it.
Mode of treatment.
Mode of treatment.
There are few modes of treatment, not just medication. Of course, medication is the main thing.
The major.
Yes. We have medication. We have the patient is taken through psychotherapy sessions. We have family therapy sessions. We have occupational therapy, where we take the patient to do some hobbies, maybe knitting, playing football. Those are the ones here.
Oh, actually I've been seeing them when I was here last year. I saw some of them were playing football, some were maybe doing some just minor works here. Oh, so those one help them to maybe to regain their.
Yes, those occupational therapy, like playing football, going, even the not mainly the female patients, all of them, they can do like cooking. We have specific days,
both female and male.
Yes, let's say on Wednesday or on Friday, they themselves, they know that today we are going for cooking sessions. Maybe they cook tea, they take the sessions, helps them to divert the energy they have towards those activities like football, because some of them has those suicidal ideas. now playing football, you engage them. Yeah, the energy they have, those aggressive patients, so that energy, it's good they go play football rather than maybe being aggressive on each other or even
Or sometimes do they
staffs.
fight or something?
Yes, once in a while, but not that much. Yes, just they keep a bit being aggressive, but not that they fight.
Oh,
Because
so
they are on medication, most of them.
so how do you guys deal with those people who are so aggressive, or you have some medicine that you guys give them so that to stop being aggressive or something?
When a patient is aggressive to himself or herself or to others, very aggressive, it's good to restrain the patient, or we have a room where you manage that patient from. It's good you seclude him for some time until the patient cools down. So in that room you place him, there are good rooms, not that it's like an asylum or something. It's a room where you are brought in food. If you want something, you can knock the door, come, the nurse will come and attend to you. Then you are put on medication. Maybe the doctor can increase the dosage for that period when the patient is very aggressive, to calm the patient down. But when the patient now is okay, has calmed down, he can join the rest, because you can't keep an aggressive patient with other patients. It can cause more harm to the patients or to the staff.
Yeah, that's true. So another question is that how long do you guys determine when the patient is brought in hospital? How long do you, maybe those kind of minor works, do you guys give them, all the exercise like playing football, maybe cooking? How long do they take so that they can start practicing or doing those kind of work?
Works like the ones for going for football.
Like exercise, maybe yeah, exercise, doing cooking, those one you have
No,
stated.
that one you don't. There is no classification like this patient can do occupational therapy, this one cannot. It's good for all of them.
Like I meant, how long do they take when the patient is brought in the hospital? Like what time? Maybe weeks, months, so that they can start exercising, or the moment they are being brought, maybe the following day they start doing those.
Oh no. Now, if a patient is admitted today, of course there are start doses for medication. Now you can't take that patient for occupational therapy like the following day, because the start doses are a bit high, not like the other doses, the continuous treatment. But the start dose, it's good you give the patient some time, like even a week or 2 weeks, to calm down, at least to have insight where he is in hospital, to know maybe the diagnosis, what he is suffering from. You even educate the patient why you are taking him for that occupational therapy. You just don't pick a patient, let's go play football. It's good you educate and then you take them.
Oh, okay. And I was asking this, what kind of advices do sometimes when the patient have recognized themselves where they are, what they were using, because sometimes those patients who are using maybe bang, cocaine, or other types of drugs, sometimes they don't recognize themselves, like they've been using them for a very long time, and now they are not they don't know themselves. So what kind of maybe advices, how do you deal with them, so that, because these are mental health, like when when they start recognizing themselves, you have such kind of maybe advices or something so that to keep them off from those things.
Now that's where we have like collaborative measures. It's not only the psychologists who can talk to patients, like the counseling sessions, the psychotherapy sessions. No, you just collaborate. If a patient was abusing drugs, you can maybe what we do, we have those sessions. You talk to the patient, you tell the patient the dangers of abusing the drugs. Now that the patient is admitted, you tell the patient, if you continue using the drugs, abusing them, it can lead to another disease. It can advance to another disease. So it's good you stop. And stopping a person who abuses drugs, it's not easier for them to just stop, like snap. Slowly by slowly.
I take time.
Like if a patient is abusing maybe a whole sachet of cigarettes, I don't know how many they hold. Maybe a day, a patient can tell you, in a day I can puff like maybe a whole packet. You can advise the patient to
reduce the
amount, because
it's difficult. They can't stop at once. Maybe they start reducing and
by reducing and taking his or her medication, coming for clinics, the psychiatric clinics or the counseling sessions, that can help. And then you advise the patient to take his or her medication as per the doctor's prescription. And then it's good for their family members to come for family therapy sessions to know how to deal with their relative, now the patient. The family sessions are done. They get to accept that this is a patient and this is how we are going to treat him, not by harassing or abusing the person, like you are wasting your life. Those ones don't help much. Family therapy is good for both the patient and the family. It shows some love and acceptance.
Wow, that's nice. Yeah, at least when family came, like they know the person and they know how to deal with them. That's good. And by the way, I've not tell you, I'm at a medical school and I'm doing pharmacy. And I think I'm learning something from this session, and most thing, like she's saying, some of them I have already know them, and I'm so happy to be here and I'm still learning something. And another question is that sometimes you find that some patient have already discharged from hospital, and maybe after some time, so 3 weeks, let me say some months, 5 months or a year, they are then brought. Maybe they have stopped using them. Someone maybe using them, or and they are then brought to the hospital again. My question is, sometimes maybe let's say like genetic mental health, some are treatable or not. Maybe it's reducing the pain or reducing the.
Or you are asking why what causes a patient is treated, has gone home, and then
Come back.
The patient is readmitted again.
Readmitted again.
Okay. As I said earlier, there are different diagnoses. So, for example, let's say a person has been diagnosed by major mood disorder or even bipolar mood disorder. That one is very common. So a patient has come, she's on treatment. Now it depends with the patient. At some point it depends with the patient. If the patient follows doctor's instructions, the nurse's instructions, even the psychologist, whatever she has been told, because I'm sure before a person is discharged, she has really gone through many sessions. That's when a doctor can really certify that a patient is now okay, has insight, is going home. Some patients don't follow instructions, like they don't take drugs as they were told before they went home. Maybe you are given a drug you take twice a day or at night, and then a patient will take it once in a day, or even prescribe for himself the milligrams that he or she is going to take. You see, now the patient hasn't followed her medication. And then let's say family sessions are always done before discharge. Now that one, if the family won't support the patient will obviously relapse, because there is no support. Maybe the family aren't buying medication when they are finished, and maybe the patient is not doing any work. The patient won't take any medication because they are over. There is no money. The family support is good. And then there are clinics after discharge. Mainly they are after 1 month after discharge. So you find if a patient won't follow his or her psychiatric clinics after discharge, the doctor won't know how the patient is going on with the discharge drugs. Or even if a patient has side effects, the doctor won't know. By coming to clinics, it helps a lot to know how a patient is faring on, if those drugs are taking him well, the side effects, if they are there, the doctor will prescribe a drug which will counteract with the side effects.
The other thing is that when the patient are discharged, what preventive measure do you guys give them or advice so that they can maintain their mental health when they are at their places, their homes, after being discharged?
We don't call them advice. It's the psychotherapy sessions. Yes. Ensuring that a patient won't relapse or come back again. That's why I was saying the patients, those are now the advices we give them. You should come for your clinics. You should take your drugs as prescribed
by doctors.
If you are abusing the let's say cocaine or bang or cigarettes or alcohol, stop. You will tell them to stop, not reduce. You just use the word stop. Yes. Because if you tell a patient to reduce,
they are going to take
it. So, but we know it's not that easier to stop once.
Sure.
So the sessions, the clinics, to come for clinics, and then if there are any side effects, the patient is allowed to come anytime to the hospital. If there are adverse side effects to be given, there's a drug they are given to stop the side effects, or the medication can be reduced, or some drugs can be stopped. Yes, those are mainly the things they are being told. And then family support is also very important. There's no way a patient is discharged, has gone home well, reaching home, the patient is just discriminated, the stigma from the environment. The patient will relapse even after a week and come back.
Another question is that because you guys have dealt with many patients who are dealing with mental health, what is the common maybe type of drug is being misused? Because when the patient come, you guys do take the history of the family, history of the type of drug he was or she was using. Which is the most common drug is being abused by many of patients?
We have number one is, of course, alcohol. There's alcohol, and then cigarettes, and then we have bang, and then we have this one that what is it
cocaine
called?
Hi.
I don't know if it's cocaine or Chavis.
Oh, it's called
they call it Chavis.
I know it.
Yes, that one.
Like Koberry.
Yes, Kuber. Yeah, those ones. I didn't know some of them. I just knew them. And then...
So alcohol is the most abused drug?
Yes, alcohol.
Oh.
Because even in college, you know, that's where most people get to test alcohol.
Yeah, for sure.
Yeah.
Most students,
yeah. Alcohol, like, it's the most abused.
But,
because many people see that it's not that harmful, but it is.
But I think recently I've seen, because I'm a student, I've seen most people are misusing bang right now. I don't know what the reason behind. Even most girls, I don't know. I've not known the what make them to smoke bang. Like recently, I can say 90% of girls,
even ladies.
More, I think
in the past it was just men. We knew that's a men thing.
Yeah, but right now, everyone, even female,
I think
are reading right now.
It's peer pressure, and then that feeling of you want to fit in a
certain company.
Class, yes. Like you find all your friends, maybe you have a birthday or someone has a birthday, you'll be invited, and then at that party there is no like much food than drugs. All the money is for drugs, and food is just less money.
Yeah, for sure.
It's just peer pressure and wanting to be in a certain class,
to fit in.
And then, you know, something I realized or I have heard from patients, I don't know if it's true. Like if you abuse, let's say, drink alcohol. No, let me use a bang. One, is it called? One?
Blunt, I think.
One blunt a day. You'll feel that feeling. You'll feel high. You'll feel nice. You'll just feel over the moon. Now the next time you'll take that blunt, you'll probably take two. The one blunt that person took, he or she will want the feeling to be more nicer than last time. So the person will take two of them. The next time she'll take three. That's how a person goes and finds he or she is addicted. It's like is it KFC that says one is never enough?
Yeah.
Yes. Now bang, there's that feeling. A person will continue increasing the number of blunts to feel nice.
Maybe because sometimes like person who like I'm talkative, so sometimes I do ask girls why most of girls do take bang. I'm collecting assumption. So someone saying that if they want to be horny or something, yeah, that bang make them to be horny. I don't know if it's true. Maybe
I don't think it makes you that horny that they are saying. It just makes you don't get to think about many things, so they are ready to be used. I don't think it makes someone horny. It blocks your thoughts. So now if you want that, you do a certain thing, your mind will fully focus on that thing, and now you'll think that yes, I'm horny. You are not, just that you are focusing on that thing at that specific time. Yeah. Because see, someone can say when you take bang, it will make you be energetic and dig a very big space. The same way the other person will say when I take
because
bang,
I think I'm receiving, like, the stories are different. When I'm at the village, people who are using bang, they say that they when they're using it, they get a lot of energy. They can do something. And over here, some are saying for the girls and for the boys, maybe like to be high, and maybe sometimes they have stress. They want to reduce the stress, or they have depression, so that's why they are consuming on using the bang or alcohol or other types of drugs.
It just gives you more energy. You get excited. Because if I take and I say, let me take bang and walk from here to town, I'll walk because I have the energy.
Your energy.
Because I've focused on that walking. And you'll say, let me take bang and go, like now the horniness. Let me take bang and go and meet with that guy. I assure you, you'll take bang and it will be fun, and you'll think
it's like mindset, right?
It's mindset. Take bang and dig a whole shamba. You'll probably dig. Not that bang, it gives you that. It's mindset.
Yeah, for real.
What you are to do at that specific time, you do it. The energy.
Yeah, thank you so much. Actually, I've learned a lot of things from you. Maybe I think when I get time, we'll do more of the video. Maybe I think it will help many people who are watching this, and maybe for the young kids, I know someone watching, it will help them, and they know the side effect of using drugs. Yeah. And thank you so much for being in my channel.
Welcome.
Yeah, I'm so happy, and I've learned a lot of things from you.
Thank you.
Yeah, so guys, this is Daisy Kwamboka. Maybe if you have a platform, people can go follow you over there. Maybe you can give your handles.
My handles.
Ama, you are not using TikTok.
Yes, TikTok, and on TikTok is at Kwamboka, and then 4 times 9999 at Kwamboka 9999. The Instagram one, I'm even checking. Because
maybe you can
I'm not
show
active.
Oh, you're not active over there.
On Instagram, it's I am _ Kwamboka 1.
You can show. I can. Yeah, that's the name. Okay. Yeah, so guys, thank you so much for being here. I really appreciate for always come to watching Racha and keep supporting me. If you haven't subscribed to this channel, I remind you guys, can you take your 30 seconds, subscribe, and let's be positive. Keep commenting positive always. And I'm so happy to be here at the Madare Hospital. I think it's the biggest, and I think I own this hospital alone. Maybe do we have others in Kenya?
Adults?
Like other hospital that deal with mental health.
Yes, they are.
I know.
But Madare, yes, it's majorly a national hospital.
National.
The only psychiatric hospital in Kenya, the national hospital referral. Ata, let's say the sub-county hospitals, they have units, but not like just a unit. They have psychiatric units. Many of them nowadays have, but Mathari Hospital is the national hospital in Kenya that deals with mental health.
Okay. So maybe I'm going to finish my video over here, and thank you so much Daisy Komboka for being in my channel. Yeah, and I'm so happy. I think you guys down there in comment section, maybe you can comment and tell us what do you think about today's video. If we're going to do another video with Komboka,
Suggest
just down there in comment section, I'm going to read them and I'll let Komboka know so that we can organize another session, and yeah, we teach you guys something, because maybe after done with my studies, I think I'll be major. I will be major into those things, hospital things, and yeah, teaching people on how to deal with certain types of diseases. And thank you so much. Yeah, thank you Komboka once again.
welcome.
Yeah. So guys, down there in comment section, just tell us whether we're going to do another video with Komboka. Yeah, down there in comment section, I'm going to read them, and see you guys in the next video. Bye bye. I can tell people bye.
Bye, subscribe.
Yeah, thank you.